It's great to be joined with Dr. Kurji, York Region's Medical Officer of Health, to answer some of the top questions we're getting in our office on the vaccine and how government is working collaboratively with the public health unit in York Region, really right across Ontario, to get these vaccines into your arms, realizing how critical it is for our safety and for our recovery. So Dr. Kurji, thank you for your leadership and your work in our community. I want to first off ask for the many seniors out there that want to know how they can get the vaccine, and more importantly, how they can sign up for the vaccine.
Thank you, Minister. So we have been working very closely with the ministry, and the ministry had indicated initially that the priorities were long-term care homes and the high-risk retirement homes. And we have largely finished the residents there and most of the staff and essential caregivers. And given that the ministry has already worked out a certain prioritization, we're working down that particular list of priorities. And this may include, congregate settings, where you would have many seniors, particularly those that may be over the age of 80. The province really would like us to move forward with respect to immunizing seniors above the age of 80 as of the 1st of March. And we're working towards that target. Maybe we might get there a little earlier. And the whole idea really is that we would move your age gaps, below 80. So it would then be 75 and above, and so on and so forth. And there will be many different ways in which we'll be reaching the seniors. For a start, we are working with some of the community agencies like CHATS to see whether they could actually transport them to our static sites or our drive-through sites. We do in Vaughan, for example, have a site at the Vaughan Cortellucci Hospital. We would most likely be having a site at the Maple Community Center. And of course, there'll be the Canada's Wonderland as well. And we're still investigating additional sites in Vaughan and maybe the Treason Center in King as well. So these will slowly and steadily get finalized. And the objective is really to see whether those that can come to our clinics, would certainly be immunized there. But for those seniors that can't come to our clinics, we will be working with our community physicians and pharmacists to see how we can reach them in other settings. The aim is really to particularly immunize the seniors about the age of 80 as fast as possible, and then move down quickly into some of the other age groups.
Yeah, and it's exciting that all long-term care residents and frontline staff who wanted the first vaccine have received it. I know some have actually received the second vaccine, completed their regimen, which is very promising and very positive. But yes, we want to get it out to the next tranche, especially for our seniors living in congregate settings and really right across the community. One exciting development that's been in the works, I know in partnership with your public health unit and the ministry, is the concept of a drive-through vaccination site, including right in our community of Wonderland. So give us a bit of a sense of conceptually, what does that look like? What does that feel like? And when can we see that actually being rolled out in our community?
So the way that the drive-through sites, and the Wonderland one is a classic example, would operate would be folks would have to have had their appointments first. It won't be without appointments. We would ask that they don't bring their pets with them because pets tend to be rather protective. And they would then drive up to one of the 4 ticket booths there and, be checked, about their appointment status. But in particular, they'd be screened for any COVID-19 symptoms. And then after that, they would join one of 8 lanes. There are going to be 4 buses that have been specially converted to be able to accept fridges that are, that have temperature regulated vaccines in there. And each bus will have 2 immunizers. So you'll have 8 lanes of traffic, as it were. The person remains in the car, is immunized, and then is directed to another area of the parking lot where they are observed by a member of York Region staff to ensure that they are okay for about 15 minutes. And then after that, they're free to go. So The instructions for all that would probably be communicated through an FM radio station, because we've been working very closely with York Region Police, and we expect that to work quite smoothly. Now, there will be other drive-through locations as well, apart from Canada's Wonderland. We're looking forward to that.
Absolutely. I know that making the vaccine rollout accessible and convenient and local is actually critical and part of the strategy to get it into the arms of Ontarians. So this is exciting news. It shows progress and momentum. I think first step is we need to get more vaccines. So I know we're working with the federal colleagues to do that, but I think it's reassuring. And I wanted residents to know firsthand from the authority himself of the thoughtfulness in building out a plan logistically to get these vaccines out. I know for many people that is voluntary, but for many people, they want one as soon as possible. So thank you again for the work you're doing. And likewise, we hope to keep in touch with the community as more progress is made. So thanks again, Dr. Kurji.
You're most welcome, Minister.